Greg Williams entered a drug treatment center at the age of 17. Today, he is the president of Third Horizon, and he is fired up about WEconnect, an innovative tech platform that is changing the game in recovery and mental health support through human connection, accountability, and gift cards.
When I entered my own recovery, I had to change how I exercised, what I ate, where I went for support, who my peer groups were. So all of those factors impact the trajectory of my recovery. What WEconnect has built is this application that coaches and provides support to people in feedback loops on making those positive life changes. Recovery really lowers overall healthcare spend. When I went to treatment at 17 years old, my insurance denied my treatment. My treatment was so effective that I'm 20 plus years in recovery today, and I still hold a bit of advocacy and anger towards that denial. Daniela and I are collaborating on engagement of the insurance company's members, and so it's a cutting edge new way to facilitate long-term recovery.
Getting sober is not the end of one's recovery, but the beginning. Daniela created WEconnect to meet people in their beginnings and support them throughout their recovery journey.
I really just launched myself in my early teenage years and in my 20s wholly into work, but I also developed a substance use disorder. And the two propped each other up for some time until it no longer worked. And that's what led to my moment of clarity 11 and a half years ago. I put myself in a 28-day treatment program, but I also at the same time found out that the relapse rates and the risk of somebody attempting recovery was really high. That felt unjust, and it felt like a huge risk to my own recovery and to these people that I just met that were in there with me from all walks of life. I wanted to build something that had accountability, human connection, and an incentive for somebody to stay on track with their new healthy habits and their recovery journey. So at the heart of our technology platform is actually the peer support specialists, the humans that interact and support the members. These are folks that are full-time employees at WEconnect. They're state and nationally certified, and they are folks with lived experience. Every single day, there are group meetings available that are also led and facilitated by our peers. There are general mental health meetings, but there's also specialty meetings. Now, once you're connected to your peer in the groups, then the peers help you facilitate, okay, what are your strengths, what are your goals, and those are visible in the app. And from there, what are the actions behind that that's gonna help you achieve those goals? And when you check into those routines, as you complete those routines, whether it's doctor appointments, going to other support group meetings, that's when you can earn the incentives. So you'll earn a certain amount of money for those challenges, and then in the app instantly you can convert those to gift cards that you can use at a moment's notice. Those make a huge impact on people's daily lives.
What's on the horizon with WEconnect?
We just launched another contract in the ACA marketplace space, and we've now become a billing provider. So now it's really about scaling that in all three business lines, so Medicare, Medicaid, ACA marketplace, and being able to make this accessible and start marketing WEconnect on a really proactive national scale to give that brand visibility. Those are some of the things that we are actively working on right now.
There's a purpose to the work that we do because it's not just the right thing to do to help people access this. It's also the financially most effective thing to do is to allow access and empower access to high quality mental health and addiction services.
At Third Horizon, we are proud to work with innovators like WEconnect, who are redefining recovery, expanding access, and building a behavioral health system that works for everyone.